The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to your Hometown Health Show, brought to you by Triology Home Healthcare, the industry leader with over 30 years of experience in providing home healthcare services such as skilled nursing, physical and occupational therapy, home health aides, and other specialized care to your homes throughout the state. Please tune in every other week as we bring you a range of good information from specialists in the field to help make you more informed and living healthy.
Good evening, everyone. I am Yolanda Santana, an IT consultant with Albus Tech, and you are listening and watching your Hometown Health Show. I am here with Teresa Hilton of Triology Home Health, and our special guest tonight is Dr. David Kateb, pulmonologist, and sorry about that. And we also have Lisa Eberlin, also from Triology Home Health. Welcome.
Good evening.
Thank you.
Thank you, Yolanda.
So we're here to introduce Dr. David Kateb to our listeners. Welcome, and thank you for joining us today.
Thank you very much for having me.
Why don't you start telling us a little bit about yourself and your practice?
Sure. My name is David Kateb. I've been practicing in the Delray Beach area for over 25 years now. Came down to Florida from New York in 1994, down to Hollywood, Florida, and then moved up to Delray Beach in 1995, and have been in the area since then.
Wow. Okay. How big is your practice, and how long have you been practicing?
We've been practicing here in the area for about 25 years.
Okay.
My practice is pretty substantial. We practice both internal medicine and pulmonary medicine, mostly pulmonary medicine.
All right.
I'd say 25 years. That is a good long time to be here and to really know the area.
Well, time flies when you're having fun.
True.
What kind of pulmonology services do you provide, and what other specialty services do you offer?
We treat multiple diseases, mostly with a population group that's available in the area. We see a lot of COPD or emphysema. We also see asthma, sleep apnea, pneumonias, unfortunately lung cancer as well.
Okay.
We also deal with sleep medicine, and we use the sleep medicine laboratory at Delray Medical Center to send patients to. I read my own sleep studies at the hospital and then provide the services to the patients.
Very nice.
Pardon me, I just jumped in there, but I wanted to let you know that if you're listening, you can also listen to us on 1470 AM and 95.3 FM. And if you had any questions for our doctor tonight, you can call 1-888-565-1470. Can you explain what the different specialties mean and how one can detect pulmonology problem and what they should do if they think they have an issue?
Okay, when you practice pulmonary medicine, as I do, you do a number of things. It's a varied specialty where we see patients in the office on a regular basis, also see patients in the hospital. The reason I separate it is because the patients in the hospital are different sometimes, being more sick with different diseases. I also practice critical care medicine. Critical care medicine means that take care of patients that are in the ICU that are severely ill. Patients on ventilators who can't breathe for themselves, patients who have more significant disease, who need medications to maintain their blood pressure and so forth. As far as sleep medicine is concerned, that's another part of pulmonary medicine, and that involves assessing sleep habits, sleep studies, and diagnosing certain abnormalities of sleep. I mean, most people have heard, I'm sure you've heard of sleep apnea.
Yes.
Sure.
But there are multiple other diagnoses and multiple other problems that arise that usually cause a problem, can cause problems during sleep.
Okay. So what kind of tests out there that you use to diagnose, pulmonology diseases and conditions, and are there any new modalities in your field?
Sure. There are always new modalities in medicine. In medicine in general, things have been changing dramatically in the past 4 to 5 years. They say that 50% of what we do in medicine changes within 5 years, every 5 years.
Wow. Goodness.
So it's pretty impressive as to what happens, and you have to really keep up. When I get a patient who comes into the office, the most important thing for me, even though things have changed, the most important thing is the history and the physical, being what the patient has to say to me, what the patient complains of. I actually spend time sitting and listening to my patients. It's a lost art almost. Unfortunately, today everybody likes to go directly to testing, but I think the history and the physical make a huge difference. Taking that information from the history and the physical, we attach that to obviously simple tests in the office. We almost always do a spirometry and a pulse oximetry. Pulse oximetry gives us the amount of oxygen the patient is carrying in their blood, and the spirometry is a very simple screening test to show us lung function. Once we have that, other tests that we use on a regular basis are pulmonary function tests, which are more comprehensive spirometries with more information, and obviously X-rays, a regular X-ray, a CAT scan, and so forth. There are many other modalities that I use, including bronchoscopies and so forth. Those are more complicated, more invasive tests that are used as needed only.
When would you need a bronchoscopy?
Well, let's say the patient, the person complaining has an infection that's not being diagnosed. A bronchoscopy is a test it's akin to what most people know about, which is an upper endoscopy. So many people have gone for a colonoscopy, let's say, or an upper endoscopy. Upper endoscopy being a scope from the top looking into the stomach. The bronchoscopies are similar. We do them in the same facility, and what we do is we put the patient to sleep with using an anesthesiologist, not complete anesthesia, just conscious sedation, and then we pass a small fiber optic tube through the nose or the mouth into the breathing tubes and into the lungs. So we're actually looking at the lungs from the inside out. When you do that, you're able to see lesions, such as tumors in the lungs. Sometimes you can see foreign bodies. As a matter of fact, I even had a patient who swallowed the whole bridge of teeth.
Oh my goodness.
And was coughing for 6 months. They couldn't figure out why.
Oh my
They
goodness.
couldn't even see the teeth on the X-ray because the teeth mostly were made out of conglomerate or plastic material,
Right.
and there was no metal part to them, so they wouldn't show up on the X-ray. But when we looked inside, we saw them and we pulled them out.
Wow.
So you could do something like that, for instance. But that's not very common. More commonly,
Well, I hope not.
more commonly, we can go in there and actually, in a short period of time, it's a rather quick test, go in there and take some washings out and samples. So let's say we'll go back to our patients from before. Patient who was sick, was coughing, and the cultures are negative and nobody could figure out what's going on. Well, if we go inside and take some washings deep down with a protected brush, which means the brush that doesn't go through the airway, then we can get samples that are specific to what's going on inside the bronchial tubes. And that way we can aid the infectious disease physician and the other doctors in actually diagnosing and treating the problem.
That's amazing.
Yeah, it really is.
So what is the most common procedure you do, and what is the most common disease would you say you see and treat in your office?
That's an easy question. The most common disease we see by far is COPD, unfortunately.
That was my guess.
Yeah, my dad had COPD.
It's a horrible disease.
Yeah, it really is.
And COPD, I don't know if you're aware, is not just one disease. COPD is a conglomerate of diseases, such as emphysema and others, and chronic bronchitis and so forth. But they're usually all come from smoking. And it comes years after you've smoked. So very frequently I'll get patients who smoked in their early adulthood and were doing fine for 20 to 30 years, and then suddenly develop shortness of breath, and they don't know why. And they come in, we examine them, we get a history, we get a previous history from them, and then we do a spirometry. And spirometry or a full breathing test or a PFT will show this very, very, very clearly.
Okay.
Yeah, that is the frightening thing about that particular disease that I've read. It can sneak up on you. Even my father, who picked up smoking, he was in the Korean War as a fighter pilot, and they handed out cigarettes to all the guys. But he quit when he was in his 50s, but he still got COPD in his late 60s, early 70s. So it was very hard to manage. That was really not
I'm
fun
sure,
to watch.
Unfortunately,
Yeah,
almost everybody sitting here probably has somebody they know who has COPD.
It's tough. It's a really tough disease. How do you evaluate patients when they come in to see you, and what are the things you look at?
I look at everything. I look at the patient as they're sitting in the chair. I look at the patient as they get up on the table for examination. I look at the way they speak to me and what they tell me. There's something called the art of medicine. It's not just book knowledge. Book knowledge is extremely important, but the art of medicine is to actually pick out what's important and what's not. So and I try to teach my students that. I have medical students that I teach, and I try to teach them how to pick up the art of medicine. But basically, what you asked me is an excellent question, because you have to look at everything. You have to look at the way the patient stands, sits, the way the patient dresses, the way they behave, their answers to your questions, and how they do things.
How they present.
How they present, exactly. And now take that, of course, with a history, and take that with a physical examination, and hopefully in 70 to 80% of the time, you have an answer before you even examine the patient,
Well,
if possible.
no kidding.
The examination is important. It's used not only to confirm what you think is going on, but sometimes really leads you in the right direction.
Okay.
It's a sign of a good doctor right there,
it
I
is.
tell you.
It is. It's holistic, I
Yeah.
think.
Some of them don't do that.
Yeah. So on that note, we're going to take a short commercial break. You're listening to your Hometown Health Show with Dr. David Kateb. We'll be right back.
If a tree falls in the woods and no one is around to hear it, does it make a sound? Have you ever felt that your voice goes unheard? And you think that you can make a difference if only someone would just listen? It's time for women in business to have a place to step into your power, a platform to embrace your hopes, dreams, and your visions, a voice to heal and restore. Your voice can make a difference. We have the platform to share your story and let your voice be heard. Be kind to yourself. Give yourself the chance to be heard and shine bright. Contact New Dawn Media by texting CAFE to 80800. That's CAFE to 80800.
Okay, the only discomfort is going through the nose, but it's sleeping.
Hello, we're back, and good evening again. I'm Yolanda Santana, and tonight we have as our special guest Dr. David Kateb, and you're listening to your Hometown Health Show. Again, if you have any questions, please call 1-888-565-1470, and we are live on Facebook at AMP2 TV. So we were talking about some of the different procedures and how your practice is holistic. You look at the entire patient, which is fantastic. It's refreshing to listen to and hear that you do that. Tell us a little bit more about your practice, and is it just you, or do you have other physicians you work with or hospitals that you're affiliated with?
I'm happy to be affiliated with Delray Medical Center, and I do my hospital work at Delray. I consider Delray one of the top, if not the best hospital in this area. I'm a solo practitioner, so I'm the only doctor in my office. and I usually divide my day usually in the morning in hospital and afternoon in the office. And we see patients 5 days a week. Actually, sometimes 7 days a week, but that doesn't count.
They have to call, make an appointment 5 days a week.
Well, we also see walk-ins. If somebody comes in and they can't breathe, or they're having difficulty, we'll squeeze them in.
That's great.
It's you have to see a doctor when you can't breathe sometimes.
That's great. You don't send them off to the ER unless it's
Try
big.
not to.
Try not to.
Try not to.
Yeah.
I mean, we had a patient this morning who came in with chest pains, and that I couldn't do anything for. So that patient we sent to the emergency room, but we
That's
did.
the one
Smart.
you don't want to mess
Right.
around with.
Right.
Nope.
But we did call the ER to make sure she was okay.
Oh.
I wanted to, and she went, visited, and came back to us in the afternoon.
Oh, okay. Good.
It's a good story.
So what type of insurances do you accept?
Almost everything. We take Medicare. We take most of the HMOs. I honestly don't know them off the top of my head, but I will tell you that we take most of the insurances.
You do. As I was doing research, brushing up on you the other night to figure out the show, and I did see you took many insurances.
I think
Which
the
is
best the best thing to do is call my office and ask, and I'm sure the young ladies at the reception desk know a lot more than I do when it comes to the insurances.
Okay, well, speaking about calling your office, how can they reach you?
My office number, we're like I said, we're at Delray Beach. My office is on Atlantic Avenue in Delray Beach, just next to Military Trail. The easiest thing to say is it's right next to Dunkin' Donuts.
Ah, great.
People always find Dunkin' Donuts. And
Good landmark.
exactly. Basically, the phone number to call is 561-637-3933. We will always answer, and we'll always try to be as helpful as possible.
Okay. And your website?
My website is katebmedical.com. I have to warn you that it's under repair.
Yes, it is. I was just gonna. That's why I didn't include it.
We gotta fix
But,
that.
Yes.
but we have
Yeah.
we have to immediately fix that.
And what's the phone number again?
561-637-3933.
Great.
So I understand you work closely with Triology Home Health and providing care to your patients. Would you describe a scenario in which you would work with them and how that works out?
I'd be happy to. To put the record clear, I've worked with many home care agencies in my career, and Triology is a newer home care agency which happens to be the best, I think. We've had a couple of patients together. Everybody from Triology has been very attentive. The work has been absolutely excellent, and the care has been excellent. And this is what I look at. My patients were very, very happy with the care. They were very happy with how quickly they were attended to, and I was very happy with the reports as to their progress and how well they did. So I really can't say anything but good things about Triology.
Thank you.
Thank you. That's very kind of you.
Nice.
We would definitely appreciate that, and we'd like to stay in close contact with the physician, especially with reporting back on the patient and how they're doing at home. So, thank you for that.
I think that's very important. It's very, very. When you trust a home care agency to send them into your patient's house, you really want to know that their patients are being taken care of. It makes me feel comfortable knowing that I can send people like as good as Triology.
Thank you.
Wonderful to hear.
That's why we're
It
here.
is, yeah.
So just turning it back around, what got you into medicine? What got you into specifically pulmonology?
Good question. You ask
still
very,
figuring it
very
out.
good questions tonight. What got me into medicine and what got me into pulmonary? What got me into medicine, I always knew I wanted to be a doctor. I never thought of anything else. I never had any idea of doing anything else. And I never tried anything else. Since I was about yay big, I always wanted to be a physician, which was kind of funny because when I was yay big, I couldn't stand the sight of blood.
No.
So I forced myself to work as to go work in one of the emergency rooms as a volunteer, and I watched as the doctor there sutured up a patient. I'm holding myself between two stretchers so I don't pass out. After that, I cured my problem. I was okay.
There you go.
Faced your fears.
Exactly.
I faced my fears and I conquered it,
great.
and I went to medical school. I basically did my residency and fellowship all in the same hospital, New York Hospital, Queens, New York.
Wonderful.
I did my 3 years of residency, and I was lucky enough to find a position for them to offer me a position in pulmonary in the same hospital.
Wow.
So I was. It turned out to be an extremely good program, extremely good area, and I was very happy to graduate from there.
Wow, that's great. I like your story.
Thank you.
And South Florida is lucky to have you.
Yes.
Yes,
That's
we all are.
wonderful.
I think South Florida is a wonderful place.
It is. It's beautiful. I'm from Boston. Moved here 15 years ago. I live in Vero Beach, but I love it down here.
I'm originally from New York,
Uh-huh.
Brooklyn, but yeah.
Yeah, I like New York too.
I'm from the Smyrna area, but still Florida.
Okay.
But
Yeah, that's northern a little bit.
yeah, it's a little quieter there, but
I understand.
I hear the weather is better down here, right?
Right.
Better than New York, definitely.
better than Seattle as well.
It's
Let
a
me
little
ask
warm in the summer, but
a
nice.
question. When you talked earlier about performing some of those procedures, those tests to identify any pulmonary disease or conditions, when you're getting a sample from, you're using, you said a brush, of lack of better terms, forgive me, I'm not a nurse, but what's the recovery like from a procedure like that? Is there any downtime for the patient? Is it painful? What can a patient expect from getting a test like that?
It's actually a very, very simple test. The only preparation that the patient has to do before the procedure is not to eat or drink before, after midnight, basically, before a few hours before the procedure. The other thing we ask them to do is not to take any medications that would increase the chance of bleeding, like aspirin, blood thinners, and so forth. But that's it. You know, when you go for a GI procedure, there's a prep, and there's the people actually have a harder time with the prep than with the test itself.
Mhm.
But in this test, there's no preparation except for what I just mentioned. Patient usually comes in, the anesthesiologist takes care of them, gives them medication, they go to sleep, and then they wake up and ask me when we're going to start after we were done. The whole test itself usually takes about 15 to 20 minutes, the actual procedure. And the recovery time is another 15, 20 minutes after that. There's no pain involved whatsoever. It's really a very, very relatively simple test and a very safe test. The only complication arises if you're going to do a biopsy, and that can cause bleeding and something called the pneumothorax. But the chance of that is rather small. In hands that have been doing this procedure for a while, in experienced hands, the chance sometimes is less than 1 or 2% than having a complication. So it's a relatively safe test. Used in the right way, can give you a very good return, good results.
That's great. So I have a question. How can we take better care of our lungs so that we don't have to come see you?
Yeah.
First thing is you breathe in the good air and you breathe out the bad air. I'm being facetious.
Yoga.
But I'm not actually. It's good to breathe in good air and
Yeah.
breathe out bad air. But obviously, your lungs are organs that usually don't get damaged unless you do something to them. So if you keep away from smoke, and you don't need cigarette smoke to develop COPD. You know, people ask me that question on a regular basis. What if I'm smoking marijuana? Is that a problem? Well, what I tell them is this: smoke is smoke. Except that when you smoke marijuana, normally you're not using a filter, so it's actually not very good. But any smoke, people have developed smoke injury and COPD from cooking over fires. Or almost any kind of smoke can cause COPD.
Goodness.
It's not the nicotine, it's the smoke itself.
It's the foreign substance entering your
Right.
lungs.
Right.
So the best thing you can do is live in the top of the mountain and breathe clean air and don't do anything bad to your lungs.
All right, here come the mountains.
Yes.
Well, I wanted to thank you so very much for being our special guest this evening, Dr. David Katev, and Trilogy Home Healthcare.
Thank you.
Again, the phone number is 561-637-3933. Did you want to add anything else?
Yes, I want to thank you very much.
Thank you as well. Thank you, Trilogy.
Thank you.
Thank you.
Trilogy Home Healthcare invites you to call our offices before making a decision about your home health and rehabilitative care. Different from other agencies, Trilogy offers specialized service that other agencies don't, providing exceptional care. That's who we are and what we do. Call us at 866-599-4959 or go to trilogyhomehealthcare.com. The opinions expressed on the